comparison. Same lighting, but there's not the same lighting because there's more light on the face. So rethink what you see. Next slide. I've never had a lump around the eyes, okay, just to make that really clear. I just want a mini something. Let's just throw that word because it's a beautiful marketing term. I just want a little this. I call it the two-finger rule. Just walk in my office. I don't want that. I want this. No. This lady on the left is post-facelift. This is the after on the left. Do you like that? All right, so I have an aesthetic vision of what you want, what I can help you with. My goal is to guide you with that education toward a result, not waste your money. Otherwise, you can just burn it in the corner if you want. Next slide. Rethinking gravity. There's a doctor in California that actually took women at 60 and measured them over their photo at 20. What he found was that there was no evidence of gravity of the face. But doc, I look better when I do this. No, you don't. The brows could fall a millimeter. I want you to look at this distance from the brow to the eyelid. It's the same on both sides. Look at the eyelid. You say, well, the eyelid's dropped about a millimeter on the right side, or yeah, on her right side. It has, but it's gone up a millimeter on the left. There is no change. There's volumetric collapse of the brow. It is not a gravitational issue. And this is what's going to blow your mind. Factoring in weight, the jawline actually goes up with aging. What? Yeah, it gets bonier in the central chin. That's what I rebuild. Next slide. This is 1 year after fat grafting. You say, well, look at that lighting. Oh my God, you must be a cheater. No, I hate cheating lighting. This is the same room, same distance. In fact, I had to turn up the lighting on the left to try to match it. This is 2 years of Botox with the photo on the right, 4 months out of Botox. She's about 85% faded on her Botox, but the skin is healed. So rethink what you think you need. But look at the light that bounces off. I can see when a woman walks through my door, a gentleman, 30 feet away their skin looks better. And that's what's great. Next slide. This is 1 year out, and you can see that she actually has a very top-heavy face. I created balance by giving her a nicer oval by designing that face and shaping it. These are all one session of fat grafting, not 20 like you've been told. I want to break all those misconceptions away. Next. One session. Uno. This is 2 years out, one session, same lighting. And she actually reveals she has no makeup on the right and no sleep. She still looks good. I can make you look good no matter if you have any sleep or not. But look at the light that just streams all over her face without makeup in the same lighting. It changes your mind about what's important. Stem cells. I don't know if this is going to work. I've seen some changes. These are sort of really interesting slides, and I'd present them as more theory than practice, because if you believe that all your skin's going to look great just from fat, I don't know. There are some thoughts that over time, a year or two, the skin can look softer. I've seen it. It's not perfect, but it works. Not necessarily consistently. Next slide. This is a lady that wanted acne scars taken care of, and this is about 9 months out, and I just did fat grafting, and the skin looks a little bit better. Is it perfect? No. Next slide. This is a charity case I did for a lady in a car accident and tried multiple scar revisions for that right nasolabial groove and didn't work. And this is about 1 year out from a single session of fat grafting. The skin looks a little bit better. So I think this is really cool. Next slide. This is a book I wrote on fat grafting. I have another one coming out in about a year. I've already finished writing it. So just different thoughts I have. I'm constantly rethinking this. What's so important with this procedure is not just artistry and technique, it's safety. Understanding the evolution of fat over time. We don't have time to talk about it now, but I just want you to understand safety first, quality second. Very important. Next. Just rethink the skin again. Stop the cause. And think about how light interacts with your work. Those are the two things that take home lessons today. Next slide. So this is the idea. Next slide. Where do we intersect? We can work together in a great partnership. My goal is to have you understand where that partnership works. Next slide. I'm going to finish this morning. This morning I was on my exercise bike and I was really trying to evoke, for me, a role model in terms of public speaking is Steve Jobs, and I was listening to his Stanford address. It's brilliant if you haven't heard it. And one of the points that I want to take home that I thought was great was his idea that
that we don't know where our trajectory in life is going to be. Sometimes we're too adamant about pushing certain things that we need to move forward. But until those things happen, we realize looking back, oh my goodness, it's so amazing that that happened. For me, I was a history major in college. I never thought I was going to ever use history. It wasn't a pragmatic choice, but it really worked. Having written all the books and lecturing, I love this. It's given me the tools to get to where I am, connecting the dot backwards. But it all starts with one simple word, passion. Don't settle. If you love what you do, continue. Follow that. Never settle. Never settle. And what he said I thought was great. I'll leave you with the words that he left, which were, be hungry and be foolish. Love life and love everything you do. And that's the difference. Is if people ask me what my work and what's different, I boil it down to one word, it's passion. I love this. You can see I bleed for my patients and I bleed for my work because this is everything to me. So I thank you.
Thank you very much. One moment before you go, I just wanted to, first of all, is there, I know we talk often about the collaboration and networking, and is there a place where people can contact or communicate with you about referrals or creating relationships?
Justine, that last slide, could you pull it for me? Did it go up on the screen? Just that very last slide, if you don't mind. Thank you. That's my email address. You're welcome to contact me. I answer emails every day. I answer patient questions every day, 7 days a week.
I wanted to say to you that I invited Sam here today not only to share with you the practices that he engaged in so that you have a better understanding of the technology and the advancements in his field, so that you can communicate those to your clients and also have a personal understanding of the evolution of what the doctors are doing and what they're going through and what they're bringing to the industry. Secondly, I want to bring a person that's very approachable. Sam will be here throughout the day, and I urge you to come up and communicate with him. I wanted to bring somebody that can both encourage you to develop relationships. These professional relationships help you establish your business. They help you establish your longevity, and they help you bring something more to your client than what you can give them personally. And it's very important, I think, and Sam embodies certainly the personality and the kind of personal approach that we can feel comfortable with in approaching a doctor, a person with his education and background and skills. So I invited him here for that very reason today, because I knew many of you would be able to connect with him, to bond with him, and to break out of your shell in order to develop the kinds of relationships that you need to with medical professionals and other professionals in our field in order to expand, not what we can perform, but what our overall understanding, knowledge, and sharing with our client base is. And so once again, I thank you for being here today. It's a beautiful lecture.
Thanks, Will. Appreciate it.